The Maricopa County Health Director says social distancing appears to be working. Today, she presented new data from COVID-19 hospitalizations that appears to show we are on the right track toward flattening that curve. Our Claudia Rupsich asked county leaders what it means and when we could see looser restrictions. Claudia?
The goal of flattening the curve, of course, is to delay a peak in cases so that we're not overwhelming the healthcare system. The data coming out of the county today is definitely good news, but we're not in the clear. The medical director today said we still need to practice social distancing.
We are effectively starting to flatten the curve.
Dr. Rebecca Sonnenschein Wednesday showed what's called an epi-curve. The county medical director says this shows efforts to social distance and keep people at home are working.
All I can say by looking at our data is that what we're doing with social distancing seems to be working because we're already starting to see that slope flatten out. But if you look at that curve, what we're doing is we're still on the increasing part of the slope. So we need to get up and over the peak and back down well below that line where we're declining and we're below what our healthcare system can manage.
The county used data from hospitalizations. It doesn't take into account people who may have COVID-19 and haven't been tested, or people with the disease who aren't showing symptoms. It also doesn't show when we can start to pull back on restrictions.
Once the curve dips below that line, we can start to pull back on those social distancing measures, and more than likely we'll have to do it gradually because the evidence shows that if you pull back all at once, you might see another peak. I don't think anyone can predict exactly when that will happen.
ABC 15 asked Dr. Sonnenschein about models, the best and worst case predictions in Arizona. She said the state has been working to develop modeling and that they're relying on the state for death predictions. Dr. Sonnenschein said the county is focusing on data reported and a process called death surveillance.
We're actually reaching out and doing a special active surveillance and screening process for anyone who dies at home to see if they had symptoms consistent with COVID-19 before they passed, or if there was respiratory disease circulating in the household. And that allows us to give our best estimate of how many people truly are dying from COVID-19.
Dr. Sonnenschein was also asked about some comments she made a couple of weeks ago at a Phoenix City Council meeting where she had said she didn't really agree with the governor's decision to close restaurants and schools. Today she said that she respected that decision and the timing and that she understood that the governor had to take a lot of factors into consideration. Reporting live in Phoenix, I'm Claudia Rupsich, ABC 15 Arizona.